The lacrimal system is crucial for tear production and drainage, ensuring that our eyes stay moist and protected. It's made up of several structures that work together, including the lacrimal gland, puncta, canaliculi, lacrimal sac, and the nasolacrimal duct. The lacrimal gland is situated in the upper outer part of the orbit and produces tears. Tears flow over the eye surface, then drain through small openings called the puncta, located on the inner corners of the upper and lower eyelids. These lead into the canaliculi, which then converge into the lacrimal sac. From the sac, tears flow into the nasolacrimal duct, which empties into the nasal cavity. During embryonic development, the lacrimal system forms from ectodermal cells between the 4th and 12th weeks of gestation. The nasolacrimal duct develops as a solid cord that later becomes canalized, forming a passage for tears. Any disruption in this process can lead to congenital blockages, commonly seen as nasolacrimal duct obstruction in newborns. Endoscopic dacryocysterhinostomy, or DCR, is a surgical procedure to treat tear drainage problems by bypassing an obstruction in the nasolacrimal duct. It's often performed when a patient experiences persistent tearing or infection of the lacrimal sac, known as dacryocystitis. The procedure is minimally invasive, using an endoscope inserted through the nose. Here's a step-by-step overview. Preparation: the nasal cavity is decongested, and local anesthesia is applied. Incision: a small incision is made inside the nasal cavity, adjacent to the lacrimal sac. Marsupialization of the lacrimal sac: the endoscope guides the surgeon to create a wide opening between the lacrimal sac and the nasal cavity, known as marsupialization. This process ensures a direct pathway for tear drainage into the nasal cavity. Healing and follow-up: stenting is rarely needed, as marsupialization is usually sufficient to maintain the new drainage pathway. Patients are typically monitored for healing progress and to ensure the opening remains patent. Endoscopic DCR avoids external scarring and focuses on creating a durable pathway for tear drainage through marsupialization. This method has a high success rate, offering relief from symptoms and reducing the risk of recurrent infections. Thanks for watching. Comment below with your questions.